Hey guys, my name is Caitlin, and today we're going to be discussing disseminated intravascular coagulation, or DIC. DIC is a condition affecting the blood's ability to clot and stop bleeding. In DIC, abnormal clumps of thickened blood, or what you would call clots, form inside of the blood vessel. These abnormal clots use up the blood's clotting factors, which can lead to massive bleeding in other places where there should not be bleeding. Causes include inflammation, infection, and cancer. Signs and symptoms may include bleeding into the skin, such as cutaneous oozing, petechia, ecchymosis, and hematomas. Bleeding from surgical site or invasive procedures such as incisions and venipuncture sites. Possible GI bleeding and hematuria. Signs of thrombosis, purpura, jaundice, hypotension, tachycardia, hemoptysis, epistaxis, seizures, oliguria, acrocyanosis, dyspnea or tachypnea, pleural friction rub, and mental status changes, including confusion. Risk factors may include cancer, infection of the blood, recent surgery or anesthesia, severe tissue injury, or complications during a pregnancy. Lab tests and diagnostic procedures include the serum platelet count will be less than 150,000 per milliliter. Serum fibrinogen will be less than 170. PT will be greater than 90 seconds. PTT will be greater than 40 seconds. Fibrin degradation product tests show increased values greater than 45 micrograms per milliliter or positive at less than a 1 to 100 dilution. D-dimer is positive at less than 1 to 8 dilution. Blood clotting factors 5 and 8 are diminished. CBC with differential shows hemoglobin levels less than 10 grams per deciliter and leukocytosis. Your BUN will be greater than 25 milligrams per deciliter, and serum creatinine will be greater than 1.3 milligrams per deciliter, and urinalysis may identify hematuria. Nursing interventions may include recognizing early signs and symptoms of abnormal bleeding, prompt treatment of the underlying disorders, prevention of further bleeding, applying anti-embolism stockings or SCDs to prevent VTE, and if those are in use, they need to assess for petechia formation, and administering prescribed oxygen therapy based on oxygen saturation levels. Treatment or medications used are plasma, platelets, fibrinogen concentrates or cryoprecipitate, anticoagulants such as unfractionated heparin or low molecular weight heparin sodium, concentrates of coagulation inhibitors such as recombinant activated protein C, or antithrombin 3, antifibrinolytic agents such as aminocaproic acid, broad-spectrum antibiotics for gram-negative sepsis, and fluid replacement and oxygen administration. The prognosis of DIC is a 20 to 50% chance of death. DIC with an infection has a higher rate of death than DIC that is associated with trauma. Thank you.